Hi again. So this is the last section here in labor and birth that I'm going to do right now to explain a little bit more about the actual delivery and the early postpartum. So we want to talk about like the actual delivery. There's a few things that are really important, I think, that I want to talk about. I want you to watch the cardinal movements clip at the end of this. So there's going to be a couple of those. Just watch those, get an idea of how the baby navigates the pelvis, how the baby turns to navigate the inlet, and then turns again, and then turns back again when it comes out, and that releases the shoulders and comes out. So you can kind of get a sense of that rotation. There's several rotations that go on, one inside or two inside and one outside. So look those up and get to know those, and take a doll and just take some piece of cardboard and cut it into like an oval shape or something that it looks like a pelvis, and practice doing that with the doll going through in the right motions and see if you can do it. And that's a good way to kind of learn that for yourself. Okay, now we're going to talk about some of the things that I think are important about the delivery. Read the chapter from Heart and Hands. That'll give you your basic overall before you watch this, so you have a foundation of understanding. But some of the key points that I want to bring up are how important it is to allow the natural stretching of the perineal tissues. So the perineal body is a pyramid-shaped piece of tissue, which is kind of neat. Pyramid is a geodesic shape, which has there's a lot of symbolism with it and power behind some shapes. But anyway, so there is this so it's like an inverted triangle in a way. So it is the place between the vaginal opening. So if this was the vaginal opening and this was the anus on the outside of the woman's body, the space between them is the perineal body. And it kind of goes up like a pyramid inside the body. So that has to, the perineum has to, the baby's head pushes on that and stretches it and thins it, and it opens and stretches for the head to come out. And that's a natural part of birth. So allowing that to stretch, though, that's what I really wanted to talk to you about today. I'm just going to bring this a little closer. Is, allowing that to really, really stretch without forcing it. So you'll have less tearing. You'll have a happier mother with less swelling and less pain after the birth. So how that works is part of the whole picture that we talked about when you allow nature to take its course on its own, and you just kind of support nature. We don't really need to have our hands touching anything necessarily. There's a time and place for touching. Depends on the mom. Oftentimes it'll be a first-time mom that needs a little bit more of that hands-on stuff. So maybe some warm compresses so she can kind of get a sense of, where do I push? Oh yeah, and kind of if you have a compress down there that you're holding on there, it's going to feel a lot better to push. And she's going to know where to push. And sometimes she needs to kind of get that sense of down and under, pushing in the direction of the way the vaginal canal is shaped. And then here's the pubic bone. The baby needs to go underneath the pubic bone. That's part of those cardinal moments, or cardinal movements, where the baby's head will be facing the mother's back at one point at the when it's at the pelvic outlet, and then the baby's head will come out and rotate back to the side where whatever side the back was on originally, or whatever side the baby's back was on. The baby's back of it, the back of the baby's head will rotate to that same side again. So the baby will be facing the mother's inside of her thigh on one side or the other of the vaginal perineal opening there. The baby's head will be facing one side or the other side. That's what a baby's head looks like when it comes out. It comes out facing down, and then it turns to one side or the other. Now, if the cord's around the neck, there's a lot of misinformation on this too. I was watching, like I said, I was watching these things, and they had them in these reclining positions for all the demonstrations for their students, and I thought that was kind of not the best thing. But they also were talking about cutting the cord on the perineum. There are so few, I honestly can hardly think of a time that would be appropriate. And there's a reason. If you can't slip a cord over a baby's head because it's too tight, which is their reasoning for this, that's the reasoning for this. We have the same training. So this is pretty universal training, that you cut the cord on the neck of you cut the cord on the perineum rather, so the baby's head is out. The cord may be wrapped multiple times. It's a variation of normal. 25% of babies have a cord, so a cord doesn't mean anything really. It's just part of birth. Babies swim around, they get the cord wrapped around. So, it doesn't really generally cause any problems. So what you do is you do what's called a somersault maneuver, and I learned this from midwives in my early years of training. So what you do is you deliver the body, but you keep the baby's head close. So this is one of those cases where, if you feel like all those tight cords in there, you got to unwind. So when you birth, keep the head close to the mother's vagina. Make sure it doesn't stay there too long at the perineum. Wait till the mother has a contraction. If she's not, give her some stimulation to the nipples, both nipples. Nice, firm nipple stimulation. Her partner can do it, or your doula, or one of your a birth assistant. You might be the person doing that. But it's just really fast and instant to get the oxytocin coming in, to get another contraction going. You don't need to do that if a contraction is going to come. But let it build. Let the contraction build. And then when she's pushing, hold the baby's head close to the perineum and just unwind it there. Just do the little somersault so it's close to the perineum, so when the head comes out, the body can kind of go and the head can stay in this, so it's not pulling on the cord, and you can just do that unraveling that way. I found success with that. Okay, so that's the cord. And why? Why do you think, this is really important, why do you think that we don't want to cut the cord unless we have to? So when the baby's being squeezed, important part of a baby's breathing preparation is the pressure, so that the lungs can expand when they come out. So it's really good, that pressure. But when the baby is descending down into the birth canal, when the baby is being pushed out and it's at the perineum, we want to Why do we want to not cut the cord? So when that baby comes out, what else happens besides the lungs expanding? You have all this pressure that's, on the baby. Suddenly they come out, and then what happens? The blood has been kind of pushed out of the baby in a way into the placenta because of all that compression. So about a third. That's a lot, eh? If you want to learn more about this, you can study Karen Strange, RN, who teaches a specialized type of neonatal resuscitation that is based on physiologic midwifery model of care management. But she does teach it to all different practitioners. And she says that this 1/3 of the baby's blood volume, that if a baby has a cord cut too quickly or on the neck, basically the baby is born hypovolemic, which is not a great way to start your life with not enough blood in your body. So all the outcomes are improved by delayed cord clamping. The research is just phenomenal on it now. So keeping the cord intact will improve outcomes for your newborn. I think it improves outcomes for the mother too, because there's a connection there, and severing it too early is not necessarily a physiologically supportive thing to do in birth. What I think is best is, of course, to have an informed discussion ahead of time about cord care, but to let it completely stop pulsating before you cut it. If you're taking cord blood, you can still take cord blood. You can still take the cord blood right out of the cord. Just don't let it clot, and don't wait too long. But you can tell when it's pretty much, it's starting to look not so plump anymore. But I think just really recognizing how important that blood is for that baby. We can do resuscitation either on the mother, on her back if she's on her hands and knees, or on a tray right beside her, or on the bed right beside her, or on her tummy, or keeping the baby close to the mother is so physiologically supportive of the mother's well-being and return to normal and stabilization. So keeping the mother and the baby connected reduces hemorrhage, reduces postpartum depression, increases the success of breastfeeding, increases the success of the newborn's stabilization as well. So keeping mother and baby skin to skin, keeping that auric energy together, we call it the fourth stage. The first 3 months are like the fourth trimester, rather. And in certain areas of philosophical study, like anthroposophy and Waldorf, they talk about the Madonna cloak. So that there's this actual energy field around a mother and a baby, and if you separate it, it's not conducive to good, the healthiest and most optimal outcome. So keeping the baby and the mother together as much as you possibly can is really, I think, a really helpful idea. It's just really, it's conducive to a healthy outcome. And so that early postpartum time, what they're learning in the post-disaster clinics that Robin Lim has in Indonesia and India and Africa is that keeping the cord just completely attached is better and letting it fall off. Less infection. So really a lotus birth, or just wrapping the placenta up and keeping it with the baby, it will naturally fall off. Or what you can do is, if you don't have sterilized equipment, just FYI, if you don't have sterilized equipment, is to burn the cord, and you have to use something between the baby so that it doesn't the fire, but you just burn it in between the mother and you can burn it with a candle, but you got to protect the baby. But that's a ritual that is I think ritual can be really, really helpful for people. And so that might be something that you'd give your families as an option. So let's see, what else did we want to talk about? I wanted to also recommend another YouTube video that I think is excellent besides the birth in the squatting position, and that is the breast crawl. So I don't know if any of you have ever seen that, but it's basically proof that a baby will figure out where the breast and the nipple is if you leave them alone and put them this way. So if you lay the woman down and put the baby on her tummy with the head between the breasts, the baby will bob around and the baby will eventually start licking and sucking and eventually find the breast. The licking and the sucking and the bouncing of the head and all that is part of it. So don't rush breastfeeding, and don't go over and force the baby to breastfeed unless the baby's been struggling with it and the mother asks you to. Because it's their journey together to navigate that breastfeeding experience, and those initial couple of hours are really crucial to that healthy experience. So allowing the baby some time to navigate that and feel more like it used to smelling the mom and the mom smelling the baby. Keep the baby from being washed. Dry the baby off to keep the baby warm, because water, and that's in the videos. You'll learn all that from the videos. So, but the critical thing here is to allow the bonding to take place that needs to happen. And how you do that, you don't have to do anything. It's all set up for us. It's miraculous, really, how well it's set up. But what we have to do is we have to try not to interfere with that bonding. So I used to use hats all the time with the babies, and now I'm learning we don't use the hats anymore, because there's a hormone that comes off the baby's head that the mother is literally bonding to. She's bonding to this individual baby, has this individual unique with all these hormones and stuff, and he's or she, the baby, is like smelling the mom, and it's just amazing. Like, they have this real connection. It's everything. It's feeling, it's smell, it's sight, it's taste, it's touch. So facilitating that, just really honoring that. Watch the breast crawl. See how innate, instinctual breastfeeding is for a baby. Trusting in that innate instinctuality. So it's been a pleasure talking with you. I hope that you've enjoyed this segment on birth and the delivery and the early postpartum. The other thing I want to talk to you about more in subsequent levels is complications. We haven't really gone into complications, and I've done that on purpose because I want you to get a sense of normal first before we start going into the complications. So keep it up. Keep up your skills. Set your goals. And let me know how it's going. You can email me at charlene@birthjoyedu.com if you want to give me some feedback about how you're doing, or ask me questions. Hope you're well. Bless you. Have a great day.